health and diseases. So, say viewers, it is the one of the NCRT second PU biology lesson in which we are going to tell about common diseases in humans, immunity, AIDS disease, cancer disease, and drugs and alcohol abuses in the adolescents. So today we are going to discuss all this thing. So welcome back to my YouTube channel AR Paradeen. So Assalamu alaikum warahmatullahi wabarakatuh. So first of all we are going to deal about the health. What is health? Health for a long time was considered as a state of body and mind where there was a balance of certain humors. This is that early Greeks like Hippocrates as well as Indian Ayurveda system of medicines asserted. See, it was thought that persons with the black bile belongs to hot personality and would have fever. This idea was arrived at by pure reflective thoughts. See, we can say in the ancient times, some peoples believe based on their trust, but they don't have any of the experimental or proofs. Okay, the discovery of blood circulation by William Harvey. See, William Harvey is the first scientist or first biologist who have shown the blood is circulating in our body. He has shown the circulation using experimental method and demonstration of normal body temperature in persons with black bile using thermometer disproved that good humor hypothesis of health. See, after William Harvey's experimental and demonstration setup about the black bile, he have cleared with the help of thermometer. See, with the help of this only, he have disproved that good humor hypothesis of health is somewhat related to us. In later years, biology stated that mind influences through neural system and endocrine system, our immune system, and that our immune system maintain our health. See, as per the habits during morning after waking up, like our mother used to give us warm water after waking up, that is we have. Okay, sometime or we don't have means what, or we lacking of means what, we don't have. For example, before some persons are not brushing the teeth, some persons are not having the warm water, like this, all those things. Okay, so these all are the factors by which the body is going to get either healthy or it is going to suffer. So next, the term health is very frequently used by everybody. How do we define it? First thing, health does not simply means absence of disease or physical fitness. See, we can't say by saying that we are physically fit or we don't have disease. We can't say that we are healthy. It could be defined as a state of complete. First factor is what? Physical. We need to have physically stably health. After that, mentally. We need to have a complete mentally healthy things and social well-being. See, for example, I may looking physically strong. Okay, I may don't have the diseases, the absence of disease in my body, but mentally I have disturbed with the death of someone which is near to me. mentally I'm not well. At that time I'm physically well, but mental state is what it is in a unstable way. The same way, the social well-being, if I am moving to a event, at that time I'm mentally not fit. Okay, no doubt I don't have any of the disease. Physically I am well, but the social well-being is also affected during this. Okay, why means if I went to an event at that time, I may stay quiet. I'm not be that much cherishing. I'm I may be. Okay, the things are going to change when I am disturbed mentally. See, if I'm okay socially as well as mentally, but physically I may having a fever, headache, stomach ache, maybe the periods, all those things. At that time, what I'm going to be physically not well. Okay, so when people are healthy, they are more efficient at work. Okay, see, if I am dealing with the lecture means I am physically, mentally, as well as socially, I am active or I am well. This increases productivity and brings economic prosperity. Health also increases longevity of people and reduces infant and maternal mortality. See, if the person is strong physically, mentally, as well as in a social aspects, at that time we can increase the productivity and economic prosperity. Okay, health also increases what we can reduce if we having a healthy aspects, healthy atmosphere, or we are having health facilities at the hospital 24/7. At that time we can reduce the infant mortality as well as maternal mortality. We can correlate this with an example. In ancient time, during parturition process, the giving birth of the baby, at that time sometime the baby is going to die, sometime the mother is going to die. But nowadays, due to the health facilities, or we can say the technology, we are preventing the infants as well as maternal deaths. Okay, so we can say it is one of the aspect we are improving. Balanced diet, the second factor we can say the balanced diet. How we can say balanced diet? It is one of the basic requirement which is lacking nowadays. See, why it is lacking means due to stress, due to work, due to don't have the time for self improvement. Okay, we are not having a proper balanced diet as in earlier or ancient days. Second thing is what the personal hygiene. Personal hygiene means what? Everything. After having pee, we need to wash out the genital parts thoroughly. After having excretion, we need to wash our hands, our excretory part. All those things we need to clean. That is known as what? The personal hygiene. Next is what? The regular exercise. See, one more thing is what? Regular exercise. If we are having a regular exercise routine, at that time we don't feel sick, are very important to maintain good health. Okay, balanced diet, personal hygiene, along with the regular exercise. These are what the key factors which are going to give us a good health. Okay, from the ancient time, we can say the yoga. Yoga has been practiced since time immemorable. See, yoga is one of the exercise, we can say one kind of method of exercise which is practiced by since we don't know even the time we can't calculate, to achieve physical and mental health. See, yoga is one of the best exercise for physical well-being as well as mental health. See, awareness about diseases and their effect on different bodily functions, vaccinations, immunizations against infectious diseases, proper disposal of waste, control of vectors, and maintenance of hygiene in food and water resources are necessary for achieving good health. See, first thing is what we need to have awareness about the diseases. Okay, what are the disease, how they are forming, from which vector they are forming, all those things we need to know, and their effect on different bodily functions. See, for example, if I'm suffering from a common cold, at that time I'm suffering from fever, cough, cold, all those things. Okay, from where I got this, I need, or in my body it is, its symptom may be different, like blocking of nose, runny nose, or sorening of the throat, all those things. Okay, next is what it is going to give effect or impact on my all parts which is related to my nose, my throat or ears. Okay, next is what vaccination. The vaccination or immunization is provided to the kids, we can say right from birth to up to 18 years. The vaccination is provided at a different intervals. See, what is vaccination? It is nothing but a 90% killed, 90 to 99% killed viruses or the bacteria. Why these are giving means to create the memory in our brain. Okay, if the disease is already spread throughout the peoples, at that time if I have given the vaccination for that means I may not suffer that much. Why means already I have memory, I have stored memory in my brain, in my immune system. At that time when the second counter attack is going to happen, my body is going to defeat it itself. Okay, I don't need to treat it thoroughly or all those things. Okay, proper disposals of the waste. See, many waste we are going to generate from our home, like recycled waste or the vegetables waste or the fruits waste or the things which have started rotting or decaying, like rice or the curry or the sambar, all those things we need to dispose it properly. Okay, control of vectors. Vectors means the organisms which is responsible for the spreading of disease from one person to another person, that are known as what, vectors. So how we need to control it? For example, mosquitoes, flies, um, Drosophila melanogaster, all those are, we can say, the vectors, how we need to control them. Next is what, maintenance of hygiene. See, whenever we are preparing the food, our mother, our sister, whoever is cooking, at that time they are going to wash the food thoroughly. Food means what, the vegetables, the fruits, whatever they are peeling, whatever they are cutting, they are going to wash it thoroughly. Okay, see, next is what, we need to take care of the food resources as well as the water resources. For achieving a good health, we need to maintain a healthy resources of our food as well as water. When the functioning of one or more organs or systems of the body is adversely affected, characterized by appearance of various signs and symptoms, we say that we are not healthy. That is, we have a disease. Diseases can be broadly grouped into infectious and non infectious diseases, which are easily transmitted from one person to another, are called as infectious diseases. Infectious diseases are very common, and every one of us suffer from these at some times or other. Some of the infectious diseases like AIDS are fatal. Among non-infectious diseases such as cancer is the major cause of death. Drug alcohol abuse also affect our health adversely. So, hope so, viewers, you are enjoying my lectures and explanation. Don't forget to like, share, and subscribe, and hit the bell icon. Allah Hafiz, दुआ में याद रखना. See you in the next video.